Whenever guys have injuries in their joints, particularly the knee, cortisone shots, right?
Yes.
Cortisone shots. If you've had a knee injury and you've been seeing a doctor, more likely you're getting cortisone shots. And there's always going to be this, I hate to call it a debate, it's really a misunderstanding between cortisone shots and PRP, right?
Correct.
Platelet-Rich Plasma. So you're going to describe to us the difference, because the difference is night and day.
Night and day is two different things.
They're two different things.
Yeah,
so go ahead. You tell me what's the difference between doing cortisone shots for knee injury versus doing PRP shots for knee injury.
Okay. So if you go into your doctor's office, your orthopedic, or whoever you're going to see for your knee, and they suggest a cortisone shot, they're going to give it the same way I give you the PRP. That's the only thing that's the same with cortisone and PRP.
It's how they administer it.
That's all it is. Cortisone shuts down the inflammation in your knee. Therefore, you shut down the inflammation. You shut down basically the immune system in your knee, the little that it has. You're not going to feel any pain. There's no inflammation. There's nothing. There's no signal. You're going to feel like you're fine. So patients believe, oh, this magical medicine just healed me. In reality, it just shut it off. Basically, it turned everything down, turned the inflammation all the way down. So now what happens?
So it basically shut off the healing process.
Correct. Yeah.
Because the inflammation and the pain is part of the healing process.
Yeah, that's why we experience it, right?
There's
we
an
hurt
injury.
ourselves. The body's inflaming it because it wants to heal it, right?
Yeah.
But if you shut it down, there's no healing.
Yeah.
And what happens when you shut something down? Well, it's going to get worse, right? Because you're not healing it. Now imagine you're out of pain, right? So that's what we all want at the end of the day. We want to be out of pain. So yes, it does wonders for that. You're out of pain. But what happens when it wears off? Now you've been treating your knee like it's been like it's a brand new knee, like nothing's ever been wrong with it, right? What do you expect? You started hiking, you started biking a lot, you started running because you felt amazing. Once that 90 days is up and that cortisone finally is out of the system, now your knee's in way worse shape. Right?
Yeah.
And now there's research showing that the actual fluid, the cortisone that goes in, is chondrolytic, which damages the joint in and of itself.
Yeah, so chondrolytic, chondro being the joint tissue, lytic being killing, dying, destroying.
Yeah, correct. So
cortisone shots literally destroy your knee.
Yeah, there's research showing that it degenerates the knee.
Yeah.
And, you're going to be doing that too because you're going to feel good. You're going to feel like you can do these things. Yeah. And it's only natural, right? So that's what ends up happening. So what I see a lot in patients is that, it's like, my knee started, here's another cortisone shot. Here's another cortisone shot, and each time it just seems like the signal just, it only lasted 2 months, doc. It only lasted 1 month, doc.
Right.
This time it's not even working, doc.
Right.
Then they do imaging and they're like, well, you're bone on bone. There's nothing we can do. You need a knee replacement, right? So now you need surgery.
Right.
For bone on bone, there's nothing really you can do. Right. So that's the story I hear night and day.
Right.
Now, with my patients that I do PRP with, basically what I'm doing is I'm injecting more growth factors, right? So what I'm doing is I'm introducing things that heal the knee. So when you inject PRP, it's going to feel full. It's going to feel a little stiff. It's not going to feel that great, But the patients over the next 6 weeks, it's going to start regenerating. Right. So it's going to start fixing what's going on. You know? It's going to start strengthening those tissues, those chondro tissues. It's going to those joint tissues, whatever that's the meniscus, whether that's different parts of the knee where your arthritis is here. These ligaments over here. We like to attack all that, strengthen those, stop the arthritic process, or delay it as much as we can, so your knee feels better. And usually what happens is the patients feel great and they can run around, they can do what they used to do, Now if they overexert themselves, it's going to start breaking down like it did to begin with, and you may need to do a PRP once a year or for maintenance or if you want to do these extreme things. But I've had patients where their shoulder mobility was like 5 degrees and now
full
mobility.
We've seen it.
This is 3 years later, full mobility. Where the cortisone shot, he might have needed some surgery by now. Attach the tendons elsewhere and be like, not be happy. So they're two completely different things that at the end of the day they do get you out of pain, but which one's going to take you longer and which one's going to help you. Right. Which one's really going to help you long term?
Well, you have one that's healing you.
Yeah.
PRP is healing the joint, and you have the one that's destroying the joint.